tuned into the Literacy Hour with Test Taking Solution and your host, Dr. Kentrell Liddell, MD, MBA. The purpose of this show is to help mitigate health disparities, improving literacy related to health, economics, and education. For all your professional development, professional management, and educational support services needs, contact Test Taking Solution, where we're igniting success. Located at 2104 Thousand Oaks Drive in Jackson, Mississippi. Literacy is knowledge and knowledge is power. Thank you for joining the Literacy Hour. Good morning, everyone, and thank you so much for tuning into the Literacy Hour. We're going to make sure that all stations are go and everyone can hear me well. Let's get these microphones set up properly here. All right. Well, it's mental health and wellness here on the Literacy Hour. And I'm excited this morning because we got a lot to share. There will, as you know, be a change once we do what we have to do. We must keep moving forward. We must turn our attention this morning to our mental health. And so we like to focus on our mental health and wellness here on Fourth Tuesdays from an inspirational and an educational perspective, during which time we share real stories, true life stories that will encourage you to get the help that you need and to not give up. Don't give up. No matter what, don't give up. We also share news about progress being made right here in our beautiful Magnolia state of Mississippi and across our country, the US of A, to improve our mental health and wellness. Welcome to the show, everyone. I'm your host, Dr. Kentrell Liddell, the founder and CEO of Test Taking Solution. And if you're joining in via our YouTube station, Test Taking Solution Foundation, then you should see a very important banner up there right about now. It says register to vote. Register to vote. If you don't do anything else this month, if you are eligible to vote, please get registered to vote. Your voice counts, and your voice matters. My daily devotion this morning was written by Pastor Robert J. Morgan in his book, The Red Sea Rules. Subtitled, "The Same God Who Led You In Will Lead You Out." Today's topic is Red Sea Rule number 7. And boy, did I enjoy reading that this morning. Bright and early this morning when I first got up. The rule that I came across was rule number 7, the number of completion. I want to share with you. It's entitled, Envision God's Enveloping Presence. Envision God's enveloping presence. Pastor Morgan always starts off his rules with a verse from the Bible, and this one is Exodus chapter 14, verses 19 and 20. The angel of God who went before the camp of Israel moved and went behind them, and the pillar of cloud went from before them and stood behind them. So it came between the camp of the Egyptians and the camp of Israel. Thus it was a cloud and darkness to one, and it gave light by night to the other, so that the one did not come near the other all that night. May God continue to add a blessing to the readers, the hearers and doers of his word. God's presence in the trial. For those of you who are believers like I am, for those of you who love Jesus like I do, I hope that you will hear what Pastor Morgan has to say this morning. And then for those of you who praise and worship another God, respectfully, if you want to turn your station at this time, you can. But I hope that you would choose to listen in as well. For your vanguard is the Lord, and your rear guard is the God of Israel. Isaiah 52:12. The angel of God who went before the camp of Israel moved and went behind them. Who is this angel of God accompanying the Israelites in Exodus 14? The previous chapter told us the Lord went before them by day in a pillar of cloud and by night in a pillar of fire. The prophet Isaiah later explained that the angel of his presence saved the Israelites. The pillar of fire and cloud in theological language was a theophany or a Christophany, a singular Old Testament appearance of God himself, specifically of God the Son, second person of the Trinity, who manifests the Father's presence. John 1:18. In other words, the Lord himself ushered the Israelites through the Red Sea. The angel of God who went before the camp of Israel moved and went behind them. So it came between the camp of the Egyptians and the camp of Israel. Thus it was a cloud and darkness to the one, and it gave light by night to the other, so that the one did not come near the other all that night. Exodus 14, verses 19 and 20. What a perfect description of our Lord Jesus, who gives light to those who trust him, but to those who reject him, utter darkness. He comforts the one and confounds the other. He is a savior to the one and a judge to the other. For his children, he serves as both guard and guide. He both precedes us and protects us. He is simultaneously our shepherd and shield. He is Alpha and Omega, the first and the last, the one who goes before, guiding into the future, and the one who goes behind, gathering up our debris, our failures, and our poor attempts at ministry, blessing us and leaving a blessing behind us for others. Consider what the psalmist declared. I look behind me and you're there. Then up ahead and you're there too. Your reassurance presence, coming and going. This is too much, too wonderful. I can't take it all in. Psalm 139, 5 and 6. As the mountains surround Jerusalem, so the Lord surrounds his people from this time forth and forever. Psalm 125, verse 2. God surrounds his people with favor as with a shield. Psalm 5 and 12. God surrounds his people with songs of deliverance. Mercy surrounds those who trust in the Lord. Mercy. Psalm 32, 7 and 10. We pray along with the psalmist, Lord, let your constant love surround us, for our hopes are in you alone. Psalm 33 and 22. At the Red Sea, you all, God put his people in a position where his presence had never been so real to them. Using difficulty, he cultivated within them a greater appreciation for himself. God's presence in the trial is much better than exemption from the trial, wrote one commentator. The Lord's presence is never so sweet, as in moments of appalling difficulty. When you find yourself between sword and sea, remember that difficult times can sensitize us to God's nearness. He's never so close as when we're shipwrecked on omnipotence and driven by despair into his chambers, where we find him a very present help in a time of trouble. Psalm 46 and 1. Envision his enveloping presence and learn to say, I will fear no evil, for you are with me, even in dark valleys and by hostile seas. I just read for you this morning, sharing with you my morning devotion, which came from a book written by Robert J. Morgan entitled The Red Sea Rules. The same God who led you in will lead you out. For the sake of our mental health, I encouraged you last Fourth Tuesday to draw close to God and to focus on him rather than on your circumstances. Well, today, on this Fourth Tuesday, our Mental Health and Wellness Tuesday, right here on the Literacy Hour, I'm encouraging you to envision God's enveloping presence. No, I'm not a pastor. I'm not even an evangelist. I'm just somebody who has tried God for herself and has found him to be worthy of all the praise, all the honor, and all the glory. Nobody can meet God given, no matter how hard we try. The more we give, the more he gives to us. No matter what you might be going through right now, I want you to know that everything works according to God's perfect will. And your mental health matters to him. He will help you and he will heal your broken heart. Give him thanks and praise him all the way through whatever circumstance you might be facing today, and ask him to lead you to the right professional with whom you can share your situation. If you don't have a friend whom you can trust, if you don't have family whom you can turn to, and if you don't have a church home, ask God. He'll show you. I'm not telling you what I think or what I read somewhere, although I love to read. I'm telling you what I know. Praise makes you feel better. It's powerful medicine. I'm your host, Dr. Kentrell Adele, and if you want to get in touch with me or ask me a question, or you can call our center at 601-714-8378. That's the number to call in this morning as well. 601-714-8378. You can also visit our foundation's website, and many of you do. Thank you so very much. You leave us messages there, and my assistant and I check that, and we respond back to you. We've met some of you, and it's been a joy getting to know you. Our website is www.ttsfoundation.org. Subscribe to this YouTube channel, and you can also follow us on Facebook and Instagram. Again, if you're on the YouTube channel, you will see our handle there is TT Solution LLC. Also, that website again is ttsfoundation.org. I hope that morning devotion helped somebody to feel better. It certainly did it for me this morning, remembering that God is with us even during our difficult times, and that he's powerful enough, all-knowing enough, everywhere, all at the same time, enough to split an entire Red Sea. If you're just tuning in, you've reached the Literacy Hour here on YouTube, heard also on WMPR 90.1 FM, WFQY 99.1 FM, and WGDQ 93.1 FM, and other affiliate stations. The phone line is open. And I want to hear your thoughts about anything that is shared this morning. Again, that number is 601-714-8378. You know how we do it. If you're longtime listeners, you know that during this hour on our Mental Health and Wellness Tuesday, and we accomplish 5 objectives. We continue our review of the all-in federal strategic plan to prevent and end homelessness. We want to be informed. We want to enhance our literacy. We can't act on that which we don't know. So we get in the know on Tuesday morning at 7 a.m. And all week long, if we're tuning into WMPR, WFQY, and WGDQ. We continue our review of the Surgeon General's Social Connection Advisory. We review the latest in mental health research by discussing recently published articles. Yes, researchers are hard at work studying mental health, wellness, mental illnesses, giving us the latest and the greatest information for physicians to be able to better treat and manage these conditions, for all of us out here to be able to better manage stress and any mental health condition we may have. So I'll share with you recently published articles by either the New England Journal of Medicine, the American Academy of Family Physicians Journal, or the Psychiatric Times. Those are my favorite go-tos when it comes to knowing what's been going on in the field of medicine, the field of psychiatry. We review what's going on in the news, too, relevant to mental health and illness. And then I usually finish up by sharing some potentially beneficial community resources, some things you really need to know about and have in your back pocket in case you need to use them, and upcoming events, some of which you might want to attend. And this morning, I'll be talking more about what's going on with our teenagers. Yeah, our children. So stay tuned. Let's start with a few announcements. September 14th, as you know, you've been hearing it advertised all across the airways. We're having a Women Empowerment Conference 2024. It's going to be at the Mississippi East Center at Jackson State University, over there off Raymond Road. We have some very powerful speakers lined up. That event kicks off at 8:30 in the morning, September 14th. That's a Saturday. 8:30 to 9 o'clock registration. And from 9 to 4:15, various sessions and the keynote speaker as well. There's information on our website as well as our Facebook and Instagram pages about it. I'll be one of the guest speakers that day, talking about reproductive health. Be bringing you some of the latest updates about the syphilis outbreak right here in Mississippi, where the hot spots are and what we can do to be safe and what we can do to prevent this condition from being acquired by either ourselves or our loved ones. We want to know, and we have the information, and we want to share it with you. Some additional important dates for you to remember. September 6th, absentee ballot applications will be available. September 23rd, absentee voting will begin. October 7th, voter registration deadline. November 2nd, in-person voting for absentee, that is, will end. And then November 5th is the general election. So Mark your calendars for these important dates. September 14th, the 2024 Women Empowerment Conference happening over at the E Center, brought to you by Apostle Vera Bishop and Sister Cassandra Jones. They are the beautiful hostesses of the event. It's all about empowering women for kingdom advancement. Some men are on the program as well, and I believe that the guest speaker is also a man. So we'll be hearing from everyone. Looking forward to that event. Again, get out the vote 2024. Those important dates: September 6th, September 23rd, October 7th, November 2nd, and then November 5th, the general election. Let's turn our attention to All-In Strategic Plan to End Homelessness. Let's see what this plan is all about. If you ever feel like complaining about your financial situation or any other situation, if you have a roof over your head, I want you to think about people who are homeless. And there are places across our country right now where homeless encampments outside are being burned. They're catching fire. And so the homeless are homeless yet again. We have to pray for them. And the United States Interagency Council, I hope they're hard at work. There are 19 federal agencies. If 19 big time federal agencies can't come together and solve the problem, then we're really in trouble. The United States Interagency Council on Homelessness was convened by the Biden-Harris administration. They've been working together on this homeless issue here in America. Homelessness is deadly. People who experience homelessness die nearly 30 years earlier than the average American. And at the average age that our fellow Americans died back in the 1900s. You all know we have to get a handle on this. We have progressed much faster and better than this. All in. That's the title of the report. It was published in December 2022. We first came on the air in November 2022. Yes, it's almost been 2 years. Look at how time flies. And a blessed 2 years at that. But it's a 104-page report. And we are on the challenges and the opportunities. Challenges and opportunities section. I plan to keep reading it, as I told you now, and I'm serious about it, until we're done with the report, or until someone scraps the whole plan, or until homelessness in our country has ended. Whichever comes first. On the air, off the air, I'm going to be sharing this report with others. And so we turn our attention to the all-in federal strategic plan to prevent and end homelessness. What does this report share with us in the challenges and opportunities? Well, through a comprehensive input process to help inform the development of the plan, that interagency council heard from many stakeholders. And they heard about the key challenges to implementation. So you can come up with a good plan, but to implement that plan is something entirely different, altogether different. You got to have the right folks at the table. I say all the time, if you want to solve a problem, at least in my lifetime, I figured it out. It just takes 3 ingredients. One, you got to have prayer. So I hope that interagency council prayed. And even if they didn't pray together, I'm sure there's some praying people on the council. They prayed individually. But prayer changes things. And so I'm glad that I now know that prayer is number one when you're trying to solve a problem. And then secondly, you must have the right folks sitting at the table. They're known as experts. Been there, done that, got t-shirts for the situation. Some of them have credentials, degrees in the areas of concern, but then other folks have what we call lived experiences. They know because they've been through it, and they're able to provide a perspective that some folks who just study stuff don't have. So they must be at the table. You can't do stuff about us without us. We can't come up with solutions for our mental health issues in teens or in older adults without the teens and the older adults. It's asinine. You can't. It doesn't make sense. So I'm glad I've learned in life that if you want to solve a problem, because I don't know everything, and I don't want to know everything. But I want to be in the room with some folks who have various perspectives, and together we're able to develop the best way forward, the best solution. So that's what this 19 membered group, this United States Interagency Council on Homelessness, did and are continuing or is continuing to do. Okay. This group got some input about the challenges to implementation as well as opportunities to advance progress. And then they highlighted those challenges and opportunities in this report. They added quotes from some of these folks whom they sought input. Okay. One of the quotes came from a provider who lives in Fairbanks, Alaska. They said, direct service providers are so crushingly tired. Woo, boy, that's tired. I've never really heard tired put that way. So crushingly. Have you ever just gotten down that bad, that tired of something or someone in your life that you just so crushing tired? Okay. They're saying that direct service providers, folks who are directly servicing those who are homeless, are tired. Please reach out to them, is what this provider said. Please listen to them, is what this provider went on to say. They need to know that people in power support them and want to improve the broken systems they're working in. Our homelessness helping system is broken. Well, sounds a lot like some other systems that I know of. Our healthcare system, to be quite frank. And I'll be talking more about that on second Tuesdays when we explore health literacy. But we have to fix the broken system. Right hand doesn't know what the left hand is doing. Insurance companies on the marketplace exchange is different from the one down the street in the brick and mortar building, but they bear the same name, but they're different insurance companies, different groups of people working for your benefit and mine as beneficiaries. It's a broken system. And when things are broken, we should work to fix them. So this provider said, listen to the folks that are providing the service to the homeless people. And in listening, the council found out that there was a lack of housing supply. That but for this lack of housing, more people could be housed. And I would add, lack of affordable housing. So lack of housing supply. While housing is the solution to homelessness, the United States suffers from a severe shortage of safe, affordable, and accessible rental housing. Prior to the pandemic, there was a shortage of 7 million affordable and available homes for renters with the lowest incomes. A shortfall, you all. The shortage is caused by many factors, including a shortage of available land and labor, increased costs of raw materials, local zoning restrictions, land use regulations, opposition to inclusive development, which is commonly referred to as, quote, not in my backyard, end quote, and the destruction of homes in climate change's path. So, all these factors play a role in facilitating the continuation of homelessness. And it compounds over time. You got people with housing vouchers or other rental assistance. They compete for the limited housing in a highly competitive rental market, and they often face stigma, barriers, and or discrimination from landlords. See, when people don't think you have much, they'll treat you any old kind of way. When they don't think you have much money, some folks feel like they got the right to treat you like a piece of trash. If you don't believe me now, I mean, you can go on the cover and try it yourself. There are some people, you will send them an email. They think that you are nobody. Some folks regard you as that. No, it's not that, oh, I'm too busy or I have 100,000 emails I got to respond to. No, they look at yours and they regard you as nobody. You ain't got any money. You ain't donating to our cause. You're not helping us. So I disregard you. And I think it's awful. I respond to every email, every phone call, because in my life, everybody is important. Everybody has a story to tell. And if I have the time, I want to listen. And if I don't have the time right now, I make time later on my schedule. But I respond. And there are really some people, high and mighty, who will look at your despair and turn a blind eye as though they can't even see you. I'm so grateful that this council sees what's going on. Now, whether or not they actually do something is what I'm waiting on. I'm waiting on the results of all this great information that's in this report. In addition, we got many landlords that deny housing to people based on a criminal record, based on your credit history. The council knows about it. Again, they sought input from people and they found out all this stuff and they put it in this report so that now we have the information. You see, you can't act on what you don't know. So now we know these things. Where are the policies improving them? Where are the policies changing all this stuff? It's wrong. How can we affect disparities if the leaders at the top aren't working hard on all this evidence in this 104-page report? It's telling us right here that we have a shortage of available land, that we have increased costs on raw material, local zoning restrictions, opposition to inclusive development, landlords acting out, denying people housing based on their criminal. I'll be so glad when folks stop acting like they're perfect. Everybody has done something they're not proud of. You just probably haven't been caught yet. And you better hope and pray to God you don't get caught, because it's something else when you're able to turn your nose up at somebody just because they're homeless. You don't know what got that person in that situation. You have no clue. And so be careful to judge folks. And you landlords denying folks based on criminal records, particularly nonviolent crimes, and they've done their time. My God, are you the judge and the jury? You're going to punish people for life? I know all about that. Punishing folks for life, sentencing them to life. They've done the time. What sense does it make that we don't even allow people to vote because of certain crimes that they've committed, that they've confessed to, that they've done the time for, that they've come out and lived productive lives on the other side of that issue, and we still have the guts, the wherewithal to say, you're nobody, you don't count, we don't want to hear your voice, but you want my tax money though. That's the part I can't reconcile. We want to kick the homeless out and kick them around. We want to kick folks with criminal records around and knock them upside the head and tell them they ain't worth 2 cents until we want something, until tax season rolls around. They better file their tax reports if they have a job, if somebody was kind enough to give them a chance. We're something else with ourselves, and it comes out in this report. Many renters of color, LGBTQI plus renters, renters with disabilities, these people get discriminated against, and you know it and I know it, when they're applying for housing. We have a lack of accessible housing for people with disabilities, and that further complicates the situation. So this morning, what you and I have learned, and we already knew it, but it comes out in this report that one reason, one challenge we face in homelessness is that there is a lack of housing supply. I'm going to give you one more challenge and then we're going to move on. We got a lot to cover this morning, as we do every Tuesday morning. Rise of rent amid slow wage and income growth. That's what the report says. The report says the price has been rising on the houses that you rent, the apartments that you rent, but your paycheck hasn't been going up. Wow. And they all sat around a table and looked at the evidence and came up with this and thought it noteworthy to put it in the report. Thank you, counsel. We've been saying it over and over, and I hear it every time I turn the television on. When I'm listening to the radio, I'm going, okay, I mean, how long does it take us to act? Why do we move so slowly on things that matter so greatly? Life and death. Wage growth has been slow for the lowest paid workers for decades. And for many Americans, rental housing is unaffordable because wages have not kept up with the fast rise of rent. I refuse to hire somebody and pay them that minimum wage of $7.25. I refuse to do it. I will not do it. And so I hold up on hiring folks so I can pay them at least $14 an hour. You come to Test Taking Solution, you see somebody working in my center, you best believe they're making at least 14 and some upwards of 20. Because it's the right thing to do. Now, I work like a dog to make that happen, but I'll do it to do the right thing. Get nobody live on that federal minimum wage, and I'll be so glad when they finally change that law and make it true across the country. $15 an hour, something like that. Everything else needs to go on up. It just needs to go up. According to a 2021 report, in no state can a person working full time at the federal minimum wage afford a 2-bedroom apartment at the fair market rent. As a result, 70% of the lowest wage households routinely spend more than half of their income on rent, placing them at risk of homelessness if any unexpected expenses or emergencies arise. God forbid your car break down. God forbid somebody in the family going through something and they call you to borrow a little money. My goodness, we're just on shaky ground. Instability. Help. In this report published in December 2022, and here we are, August 27, 2024. How much progress have we made in ridding our country of homelessness? I don't think we're going to do it until we rid our country of injustice and unfairness. Stuff just ain't right. And I said it just like that. I know the proper vernacular. You know I do. I got more credentials than a lot of folks. But listen, I it really just bothers me. Housing unaffordability disproportionately impacts people with disabilities. It disproportionately impacts people who are LGBTQ. It disproportionately impacts people of color. Why does everything have to disproportionately impact those of us? Why? Because we're not the ones in power. I don't know too many of us who owns apartment complexes and houses that we're renting out to folks. Until this land ownership and home ownership and all this stuff gets to be more diverse, so that folks who know what it feels like, and I'm not insinuating that those who own it don't necessarily know. They know. Some folks just don't care. They think you down. They're going to try to keep you down. They'll knock you down even further if they can. And I call that evil. Discriminatory employment practices toward these groups further contribute to the disparities. Did you hear what I just said? They're already being discriminated against because of the housing unaffordability. And then for those who are trying to get a job, you got other discriminatory employment practices going on. I'm not going to hire you because you have a disability. I'm not going to hire you because you're a person of color. I'm not. Just horrible. Similarly, there is no housing market within the United States in which a person living solely on supplemental security income, SSI, can afford housing without rental assistance. That's what the United States Interagency Council on Homelessness found out. They say folks can't afford the housing that is available, no matter how hard they try. They can be working full time at federal minimum wage. They can be on SSI and still can't afford it. Guys, Houston, we have a problem. And looks like the problem got exposed in one place called the All In Strategic Plan that was published December 2022. We're going to keep reading it because I can't wait to see what it is they say they're going to do, where they're going to do it. Mental health and wellness are important topics. And we at Test Taking Solution Foundation are going to keep providing public service announcements and raising awareness about both. We'll keep raising awareness about homelessness too. And in the meantime, if you're in the market for a new home and if you have a steady source of income, you might qualify for a USDA single family housing direct home loan and 100% financing. But you know what the challenges are. You've heard one about some of them this morning. You heard that, there may be a lack of affordable housing. Well, the USDA, which seems to be in the middle of a whole lot of funding opportunities, doesn't it? My goodness, the USDA single family housing direct home loan. Test Taking Solution wants to help you get your loan application together. Someone sent me a note a moment ago and shared with me that a Black guy proposes building 200 homes in Councilman Kenneth Stokes' district. I think I heard about that. The little tiny homes, I believe. I wonder where that is by now. And if you want to talk about it further, then callers, please, 601-714-8378. Test Taking Solution can help you get your loan application together. We've helped two individuals to get theirs together. It was a fairly long process, but we got a family holding a 300, almost close to $400,000 certificate of eligibility. They can go and shop for their home now. Yeah, it works. We can't guarantee that you'll qualify, but we can certainly help you conduct a self-assessment and package your loan if you do. Call our office for an appointment. We'll get you in and get you started. Let's now continue our review of the Surgeon General's Social Connection Advisory. I told you we'll talk about that this morning. This morning is all things mental health. Caller, go ahead and call in. You tried, and I'm going to pause to listen to you. Y'all tell me all the time, Dr. Liddell, I just don't want to stop you because we got to know all this stuff. Well, I'm inviting you to stop me. I want to hear from you. We've been sounding the alarm since late last year that we have an epidemic of loneliness to contend with. Loneliness is a profound public health threat. The Surgeon General, Dr. Vivek Murthy, as a matter of fact, he's been our Surgeon General twice. He was our 19th, and now he's our 21st Surgeon General of the United States. Our epidemic of loneliness and isolation, the United States Surgeon General's 2023 advisory on the healing effects of social connection and community. I said, it's about time. When I saw this report, I got so excited. I said, it's about time. Somebody figured out and realized that you can have all the hospitals and clinics and medical stuff you want to have, and buildings and offices and departments of this and departments of that, until you involve the community. Until you involve community organizations and leaders in the communities, we're not going to solve the problems. His report details that lacking social connection can increase the risk for premature death as much as smoking up to 15 cigarettes a day. You see, that's why I told you to keep your mouth off people. While you looking at somebody talking about, oh, he's smoking himself to death, you might be lonely. You might be socially disconnected. You too are at increased risk for premature death. As a matter of fact, a group of researchers recently discovered that loneliness may be associated with higher stroke risk. Yeah, you may have heard about it on CNN. I heard about it there. I also read it. It was an article published in eClinical Medicine. And it was just this past June 26th is when it got reported on. Lonely isn't just how many people are around. It's how you feel. You can be in a crowd and feel lonely, feel unheard, unseen. What we spoke this morning about a group of people, several different groups of folks that are walking around out here. They are amongst us, but some of us are so mean and evil, we act like we don't see them. We act like we don't hear them. Shame on us. And a lot of us profess to be Christian, profess to love God. Well, let these folks get up. Let folks get back up. We got older adults. We're so quick to push people to the side. Keep living. Keep on living. And you too will cross that bridge one day. If you're blessed to live to see some of these ages. I honor our elders. And I know there are some of you out there who do. You listen to them. Many of them been there, done that. They can share all sorts of wisdom and pieces of advice with you. I had the honor of sitting with two wise counsel yesterday. Oh my God. My heart, I had breakfast with two of the greatest. Oh man. Dr. Wesley Prater, Dr. Beverly Wade Hogan. Man, I was just a kid looking up at them, a little Tulu college kid. But every now and then, these are people who still check on me and others. They just check on us. And I thank God for them. They have no clue, no idea what that means. And you have no clue what it means when you turn back and check on somebody behind you. Check on somebody coming up. Just check on them. Ain't nothing got to be wrong. Call in and check on them. How are you doing? I was thinking about you. One of my best friends called me the other evening. She and I, we laughed and talked, and I was so happy to hear her voice. She was happy to hear mine. And she just said, I hadn't heard your voice in a while, Kentrell. Just wanted to chit chat and talk with you and catch up. I invited her to the women's conference. Come on over to that. And after we finish that shoot, we need to go on a cruise or something if we can find time to get away from these jobs. But it's important to connect with someone. So this report talked about loneliness being associated with a higher stroke risk. Specifically, older adults who reported being chronically lonely had a 56% higher risk of stroke than those who were consistently rated low on the loneliness scale. according to this study. Although there was a strong increase in risk for people who scored high on loneliness at both points of the survey, there was not a clear association with the stroke risk in those who only scored high at one point. The lead study author was Dr. Yanay. And again, all of this information is public information. That's why we share it so freely. But I love the literacy hour because here we jam pack it in this 1 hour and we talk about things. First Tuesday, education literacy. We talk about what's going on in our educational system right here in Mississippi. Second Tuesday, health literacy. We talk about the closures of the rural hospitals, and we talk about the disease outbreaks that we're facing. And next Tuesday, we're going to be talking about COVID-19 and how it's trying to resurge. We're going to talk about a lot of other things too that I just got to get off my chest about our healthcare system. And then the following Tuesday, financial literacy. Oh, yeah. Oh, yeah. We knew about NVIDIA when it was $7, $8. Okay. And so we watch the market. We talk about financial terms and phrases that are important for us to know. We talk about balancing budgets, and we look at the Federal Deposit Insurance Corporation, the FDIC, and their curriculum for kids and their curriculum for young adults. And we do all that, financial literacy. And then on fourth Tuesdays today, we turn our attention to our mental health and wellness. And we talk about things that are relevant to how we're feeling. Again, I'm so grateful that you decided to tune in to this morning's episode. I want to segue now and review the latest in mental health research. And today I want to discuss mental health challenges. Yes, our research shows that there are some symptoms that when you start experiencing these symptoms, you need to talk to a medical or mental health professional. Need to talk to somebody if you're feeling fear and dread and worry frequently. And in non-stressful situations, if the situation ain't stressful and you still walking around feeling dread and worry, you're sweating, rapid pounding heartbeat, shortness of breath, unexplained aches and pains, difficulty sleeping or concentrating, you're trembling, you're twitching, don't disregard these symptoms. Talk to somebody. You might have anxiety disorders. If you have this ongoing pattern of interfering with functioning and development that can include inattention, you have difficulty focusing, you're very disorganized, hyperactive, constant moving, fidgeting, talking, impulsive, making hasty actions without thinking first. You might have attention deficit hyperactivity disorder, ADHD. Talk to someone. Bipolar disorder, extreme mood swings. 1 minute you're okay, the next minute so 1 minute you're up, 1 minute you're down. You have these emotional highs and lows. We call that mania or hypomania. And depression. You can have changes in your sleep patterns, uncharacteristic behaviors. It doesn't last a minute, it lasts days and lasts weeks. That could be bipolar disorder. You need to check with someone. You need to get help. And I'm going to give you some numbers here before we get off the air today of people whom you can call. They'll be glad to see you, glad to talk with you. Feeling sad, feeling hopeless, numb, irritable, anxious, feeling guilty about something. My goodness. It is normal to feel these ways sometimes. But when these feelings interfere with your functioning, when they last days and weeks on end, when you've lost your interest in enjoyable activities you once really enjoyed, when you have a change in your appetite, your sleep pattern, you're tired, unexplained headaches, cramps, digestive problems, thoughts of death or suicide, it's time to take action. What all of these conditions have in common, you all, is that they're treatable. Sometimes they can be managed with lifestyle choices like good sleep, regular exercise, healthy eating, changing your outlook, a strong social support system, having a church home. Sometimes for some people, these are the cures: getting a good night's sleep, exercising regularly, eating healthy, changing your outlook, getting a strong social support system. But as with many illnesses, one size doesn't fit all. One pill is not good to treat everybody's illness. It doesn't work that way. If somebody told you that, they lied to you. And so your situation is unique, and that's why we invite you to speak to someone. Representative Shonda Yates is co-chairing a committee. We're moving our attention to what's going on right here in our state and across the country relevant to mental health and wellness. Representative Yates is co-chairing a committee called the Select Committee on Capital and Metro Revitalization. She's co-chairing that committee. The goal of the committee is to address various issues that are impacting our capital city and the surrounding metro. These issues are varied and will include things such as blight, crime, water infrastructure, and, you guessed it, homelessness. The first hearing of this committee is going to be August 29th. That's 2 days from now at 9:30 in the morning at the Capitol in room 113. So if you want to be in on this committee, you want to hear what they're talking about, it's co-chaired by Representative Yates. Find your way to the Capitol and get to room 113 on August 29th at 9:30. This hearing will focus on blight and state-owned tax forfeiture properties in the city of Jackson. They have multiple speakers slated, including individuals from the Secretary of State's office, the city, law enforcement, and Jackson Redevelopment Authority, among others. They're going to discuss the issue. They're going to work towards crafting solutions. Now, they had me till they got to that part about working towards. I understand you get a group like that, you got to work towards. Discuss the issue and craft a solution. When are we going to get to that? We see what the issues are. They're right here staring us in the face. And somebody has the keys to the kingdom. Somebody can make a difference. And then maybe they can't. I don't know. Maybe they can't. Maybe it needs to be a change somewhere in a couple of places. Listen, if medical bills are stressing you out, relief is on the way. CMS, Centers for Medicare and Medicaid Services, reports that more than 12,000 No Surprise Act violations. I told you about the No Surprise Act when it became law. I told you the hospitals and clinics and all these folks in the medical world, we can no longer surprise patients with bills. I mean, you go to the grocery store, you look at your receipt, you see what you bought, you know, you look at the aisle, the price tags on the different products, you know what you're going to pay. I've always felt in my heart that we should be doing the same thing in medicine. There should be no surprise bills. And so CMS has deemed a whole lot of entities, okay, for doing these no surprise bills. The Centers for Medicaid and Medicaid Services released a report on the complaints and enforcement efforts concerning the Public Health Service Act. That's what you call that law, the Public Service Act, and it includes the No Surprise Act. This report showed that as of June 30th, that's why we like to keep this information relevant now, CMS received 12,077 No Surprise Act complaints. 1,777 of those were against insurance companies. 10,300 of those were against hospitals, other providers, air ambulance services. They say the most common complaint was, I got a surprise bill for a non-emergency service at an in-network facility. You see that? The insurance tells you on your card or if you call in or on that paperwork that all of these providers are in your network. You can go to them. And then you go to them and you still get a sky-high bill. Something is wrong. Surprise billing for emergency services. So CMS is investigating. They have been investigating and they have told certain plans and insurance companies and providers and healthcare facilities and others, you got to get your house in order. And it has resulted in approximately $4,183,000 in monetary relief. CMS is not playing. They're not playing with this No Surprise Act. Y'all, I got so much other stuff I want to share with you this morning, but we're clearly out of time. And man, we get all I can do is just say y'all need to join me back here again next Tuesday. I want to tell you how the Surgeon General is calling for warning labels to be put on social media. I told you I would give you a phone number that you can call to get some help. And so, you know what? I'm going to let us do a station break and I'll be right back on the other side. And we're back. All the challenges we've discussed this morning, you all are compounded by the overall shortage of mental health professionals. You know it. I know it. Here are a few resources and upcoming events to help you on your mental health and behavioral health journey. Listen to me. It's okay if you or someone you know has a mental illness, is struggling emotionally, or has concerns about their mental health. I want you to take advantage of these resources to find help for yourself, a friend, or family member. It can be challenging to navigate the complexities of mental health and well-being alone, but we don't have to do it alone. We got professionals like Dr. Clyde Glenn, located in Ridgeland, Mississippi. Call 888-561-3380. Dr. Glenn also has a website, www.rehob, as in boy, OTHPSYCH, RehobothPsych.com. If you desire to learn about the psychiatric services provided by Doctors Celeste and Clyde Glenn, a husband-wife team, they both attended the University of Iowa College of Medicine like I did. They're located at 357 Town Center Place, Suite 400, Ridgeland, Mississippi. Again, the phone number to call is 888-561-3380. Gordon Medical Arts Clinic, located in Clinton, Mississippi. Maybe Ridgeland is too far for you to drive, and maybe you live in the Clinton area. Gordon Medical Arts Clinic. They specialize in counseling, general medicine, internal medicine, psychiatry, and substance abuse. The phone number to call is 601-488-8101. And then there's Infusion Metro, an affiliate of Hines Behavioral Health Services. They provide mental health services for children, adolescents, and young adults who are at risk for or with serious emotional disturbances aged from birth to 21. And man, are they good at what they do. Everybody I've listed this morning, they are very good at what they do. They care. It's not about the money to them. It's about your mental health and wellness. So Infusion Metro, Mr. Ray McCants is the contact person, 769-233-7429. The number again, 769-233-7429. Restoration House Ministries. It's a 12-month faith-based residential facility for men 18 and over to help them overcome any kind of life-controlling issues such as addiction, alcoholism, depression, anger, and suicide. Call 865-352-1274. 865-352-1274. They also have a website. R as in restoration, H as in house, M as in ministries. RHMSEV as in volleyball, IER.com. If you want help finding ways to get socially connected, if you need help finding a job, call Test Taking Solutions, 601-714-8378. And then this number, the last one I want to leave you with this morning, is probably one of the most important. The 988 Mental Health Crisis Line. The National Suicide Prevention Lifeline is still available, and you can call or text the number. Yeah, you can text it. The number to the mental health crisis line is again 988. Don't ignore suicidal thoughts. Suicide is the ultimate sign of despair. And in attempting to end mental and emotional pain, suicide eliminates any chance for change and happiness. I don't care how old you are. Please dial 988 if you're thinking about harming yourself. The National Suicide Hotline has already fielded more than 10 million calls over the past 2 years. Almost 2 million of the 10 million, while 1.2 million were calls answered by the Veterans Crisis Line. That's an option that allows service members and veterans to press 1 on the phone's dial pad to reach some help. And so that 988 number, keep that number close and near. I want to end this mental health and wellness episode of the Literacy Hour on this 4th Tuesday by sharing some words of encouragement. If you're a child, please stop blaming your parents, grandparents, or guardians for what they're not able to give you. Many of them are doing the very best they can, and you know it. You want a different life? Finish school, pray, study hard, and make your dreams come true. If you are a parent, please stop blaming yourself for your child's mistakes in life. It's not your fault. If he or she is 18, then they're considered an adult, albeit a young adult, but still an adult nonetheless. You raised him or her the best way you knew how. No instruction manual comes with these kids. You just have to pray, seek God, and do the best you can with what you have. At 18, whether you like it or not, they will be treated as grown. When my son was admitted to the United States Military Academy Preparatory School at West Point, the school never corresponded with me again. They were done with me. They regarded my son a full-fledged adult, and they dealt directly with him regarding all school matters, all health matters, all matters. There he was in New York, and here I was in Mississippi. They didn't really know his upbringing. I'm sure they don't really know any of those kids' upbringing. They know the application they put in. They know what the reference letters have said and this and that. But I will love to tell them that not all children develop at the same rate. As the parent, I was left in the dark until it was too late. Parents, stop blaming yourselves. Be a good parent. Support your children. Give them the best advice you have. Help point them in the right direction for expert advice. But stop blaming yourselves for their mistakes. I'm going to end it right there. The Test Taking Solution Foundation is a public 501c3 charity, which means that your cash donations are 100% tax deductible. We have amazing, very responsible and capable board of directors. And our next board meeting is Thursday, September 12th at 4 p.m. at our Education and Research Center, located at 2104 Thousand Oaks Drive in Jackson. You're welcome to review our outcomes, the financial statements, the board meeting agendas, the minutes, anytime you want. A career is finite. Our lives are finite. But the contributions we make to this world, they have a different life shelf. Until we meet again, I want you to take a position that's bigger than yourself and join me right back here again next Tuesday, same time, same place, right here on our Test Taking Solution Foundation YouTube channel, WMPR 90.1 FM, WFQY 99.1 FM, or WGDQ 93.1 FM. Be safe, everyone, and have a great rest of your day. For the past 1 hour, you have been listening to the Literacy Hour with Test Taking Solution and your host, Dr. Kentrell Liddell, MD, MBA. We are located at 2104 Thousand Oaks Drive in Jackson, Mississippi. Visit us on the web at www.testtakingsolution.com. Join us each Tuesday from 7 to 8 a.m. for another life-changing conversation here on our podcast live stream and affiliate stations.